That came back clear, so it was just a very small sample. So they haven't ruled it out. They just said they're going to keep an eye on it. My lungs, again, I'd had chest infections, so they had put that down to me having swollen nodules because of my chest infections. And my lower back, it turned out that the radiologists suggested that it was degenerative. So unfortunately, I think I have got degenerative arthritis in my lower back, knee and foot, which nothing to do with the cancer. It's probably more to do with the fact that I have been putting a lot of pressure on those areas over the years with my weight, and I have to accept that. But I don't think I've ever been so happy to be diagnosed with degenerative arthritis. So that's good. So all in all, it was as positive an outcome as I could have hoped for. Then I had obviously had my surgery at the beginning of January. That was interesting. That went really well. The actual surgery went really well. I was in and out in a day. However, afterwards, I got an infected breast and underarm. The difficulty we've got is that because I don't have any lymph nodes in my underarm, obviously whenever you have an operation or there's some trauma to the arm or that side of your body, the lymph nodes would then, you then produce something called lymphatic fluid, which I think is to help regenerate or something. But anyway, the lymphatic fluid usually gets absorbed by the lymph nodes. In my case, obviously, I've got none, so they did warn me that there could be residue that they would collect. Some people need to have it drained regularly. It can cause lymphedema. Unfortunately, in my case, actually, what had happened is that the butterfly stitches they put on my wound did not close up the wound properly, so it got infected. It was quite traumatic. I had to have it drained. Then they had I actually caught sepsis. So I got sepsis because my body couldn't heal it. Had to be carted off into hospital by an ambulance, which was horrendous. My poor little boy, Max, had to watch as I kind of declined very quickly within an hour. But, I was taken to hospital. I was in there for 5 days. It was pretty horrendous. I mean, I don't know if any of you have had sepsis before, but basically your whole body just kind of shuts down. You can't walk properly. You can't, your temperature's rockets. I mean, I think it was like 41 at one point. I was delirious. It took a couple of days for me to get back on my feet, but it was pretty intense. So then they gave me some antibiotics that didn't work. So I ended up having to go back into hospital again and having more IV antibiotics. And I finally got it right, and I was able to recover. It's closed up now. It seems to be healing fine. And I started my next stage of chemo yesterday. So, for those of you who want to know why I'm having chemo again, so when they did the operation, they took a biopsy of the tissue they removed. There didn't appear to be a lump. However, the tissue that they removed still had cancer cells in it. So for that reason, they see it as a partial success, and it didn't completely kill everything, which means that there could still be like little hidey cells dotted around. So what they've suggested is putting me on a preventative or chemotherapy tablet form called capecitabine. Or CAPE, I think people just call it CAPE, or Zolex, I think, X. Some people call it X. Sounds like my old days going out partying, but no, it's not. It's horrendous. It's having to take chemotherapy. So the tablets are quite large. I have to take them twice a day. after meals, and I have to take five each time, which is horrible. And this drug is usually given to cancer patients who are stage 4 as sort of a preventative treatment. It's when people have to live with cancer, so it is normally given to people who are living with cancer and they're at stage 4. The reason why they've decided to make me do this for 6 months is it's been proven to eradicate those last few cells that could be lingering around, and hopefully, prevent a recurrence, because the first 6 months is when normally people have a recurrence after chemotherapy. So fingers crossed, it'll be worth it. But obviously what it does mean is that I've got another 6 months of not being able to get my life back to normal. I haven't worked really since the beginning of December. And granted, I have been completely flawed in that whole time. There would have been no chance of me having done work, to be fair. Mentally, physically, I was just wouldn't have been capable. But I was really hoping that I could just have my radiotherapy, that would be over by the end of April, and then I'd be able to get back to work and get back to normal life. It's not been that way. It's difficult, there's times when I have days where I just feel hopeless and beside myself, that I can't go on like normal. The chemotherapy really, really battered my body, so I was having difficulty just walking to the bottom of the road, for example. I am getting stronger. I've been told that this medication won't cause the fatigue that it caused when I had it via IV. So far I feel okay. I feel nauseous, queasy, a bit tired and achy, but nothing compared to last time. I've been told again that it's cumulative, maybe by cycle 3 or 4, the effects will take hold a little bit, but in the meantime I'm trying to just do what I can to stay active and try and be normal. The biggest threat really with this kind of treatment is the threat of neutropenic sepsis, which we all know that is what my body loves, to be neutropenic and septic. So in terms of that, what that means is that, I am susceptible to a lot of illnesses. The coronavirus situation is scary for me. I know that people are saying that, it's been over-egged and that, people shouldn't be so worried about it. But people like me should be worried about it because, any infection for me, virus or otherwise, is dangerous. And neutropenic sepsis is the one thing that can kill people with cancer. And it is a worry, and I do have to be very careful. So it does mean I can't be around big crowds of people. I've got to be very careful when I go out, washing my hands regularly, staying away from sick people. So in that sense, it does put it on hold. And it also means that it's very difficult for me to go out and find a job at this stage. So whilst I might not be feeling too bad at the moment, there is an element of isolation that is worrying. So yeah, I'm going to be on these tablets every day for 2 weeks, then 1 week off, then another 2 weeks, then 1 week off. So I'll have six or 7 cycles again, maybe 8 cycles of this. And yeah, I don't think it's going to be particularly easy. One good thing is you're not supposed to lose your hair on it, so I'm fingers crossed. I haven't got much, but it is coming back. I don't know if you can see it, but it is coming back in patches. I'm still wearing wigs and things like that. So yeah, that's one good thing. And the other good thing is that I don't think it's going to be as debilitating. So I will be able to see friends. I will, be able to get people to come over. But I have no doubt in my mind that I'm going to end up in hospital again with neutropenic sepsis at some point, because unfortunately I have a 5-year-old and he goes to school, and it doesn't matter how careful I am, I'm probably still going to pick something up, and my body doesn't do well fighting. So that's the downside. I miss work immensely. I mean, I just sit here thinking about ways in which I can, get back to work, get back to normality, do something that's going to make me feel like I've achieved, because I am not a housewife. I never have been, never will be. I don't enjoy it. And in some ways I am very isolated. I can't, have to kind of stay around the house. I occasionally go for, the odd walk. I've walked down to the bottom of the road today, and I might probably walk to pick Max up as long as the weather is okay. But it's not the same as having human interaction. So it's tough. I can have radiotherapy with this. So I'm going to have that. There is a waiting list. Apparently at the QE, it's like 6 months or something from what the doctor was saying. So I'm going to Coventry to have my radiotherapy, which I will have at the same time. And I would imagine that that's going to be the tough time. So I'm going to try and enjoy stuff when I can, as I can. And I just want to say thanks to all my friends who have been really supportive throughout this. It's worrying for people. I understand that. This is like a really long video, so I don't think many people are going to watch it to the end. But the reason I'm not going to parties and I'm not going out and doing stuff is because I've got to be careful of infection. But you can come here. You can come here if you like. Just text me, phone me, whatever. I've got a lovely play date on Sunday with Cash, who's bringing Coco, who's his dog. So I love a bit of doggy time. That's awful. I love a bit of some doggy cuddles. They're pretty good. Baby cuddles and doggy cuddles are always nice. And yeah, fingers crossed I am going to get through this. It's only another 6 months. Hopefully, with any luck, the nightmare will be over and I'll be able to try and get some sort of normality back into my life and get fit and just be able to do stuff, because that's what I'm missing. I'm sociable. I'm hating being at home. I'm hating being a housewife. I'm hating being, a stay-at-home mom. It's just not. I know it's not a choice that I have, but it's not my favourite. So let's keep going, and I'll try and do updates as and when I can.